So in the second line setting, pembrolizumab was approved based on a single arm phase 1/2 study in advanced liver cancer and showed a response rate in the 15 to 20% range. And it was required that a follow-up phase 3 study be done to confirm its activity. And that was the Keynote 240 study. That study was published in JCO in 2020. But at ASCO GI 2021, we presented longer term follow-up from that study. And as many of you know, that study actually showed an improvement in overall survival from about 10 to just under 14 months with pembrolizumab versus placebo in the second line setting. However, because of the statistical design, the study was not positive. The p-value just missed the required p-value for significance, even though it was 0.02 in the 0.02 range. And so many of us viewed that as a disappointment because it confirmed the response rate of about 18% with single agent pembro. And the side effect profile was very favorable in that study, other than the known immune-related adverse events that we can see with pembro. And now with longer follow-up, we see that that survival has been maintained, that median survival response rate has been maintained. There's no new safety signals, and there's a clear tail to the curve and when we look at progression-free survival, that there are a subset of patients who have disease control on the order of 2 years or longer. And at this point, it's challenging to identify those patients. We don't have a biomarker for those patients. But I think even with that data set and the phase 3 study not meeting its statistical endpoint, for patients who receive a TKI in the frontline setting, pembrolizumab or single agent nivolumab remain options for patients at progression on frontline. Now, in regards to nivolumab, we also saw updated data from the CheckMate 040 study. 040 was a multi-arm non-comparative study of various nivolumab-based regimens and dosing. And that was the basis for nivolumab's accelerated approval in second line based on response rate and long duration of response. And also part of CheckMate 040 was the combination of ipilimumab and nivolumab, which also got accelerated approval based on that data set. And at ASCO GI 2021, we again saw long-term follow-up from this regimen, which confirms that the regimen is active. The combination has response rates of 30%. It is associated with a higher frequency of immune-related adverse events. About 50% of patients require steroids during their course. But this regimen is now being evaluated in a phase 3 study of ipi-nivo versus sorafenib, and we eagerly await those results. And there are several phase 3 studies ongoing in liver cancer in the front line, novel combinations of lenvatinib and pembrolizumab, also the combination of durvalumab and tremelimumab, CTLA-4 and IO combination, also ipi-nivo as mentioned, and finally cabozantinib and atezolizumab is in a phase 3 study in advanced liver cancer as well. So an exciting time, I think. A lot of data should be coming out in the near future. But again, at this time, the bar to beat, I think, is atezolizumab with a survival of over 19 months. And for those patients who respond with a 30% response rate, the median duration of response with that regimen is over 18 months. So the next generation of studies, I think, will probably be building on a doublet backbone, atezo-bev, or possibly one of those other regimens I mentioned that's in phase 3. And a real challenge, I think, is what do we do after progression on frontline IO? How do we overcome that resistance?